Thanks for joining us for Help Choose Home When Care is Needed, a podcast that's all about the value and benefits of receiving care in a place that you likely feel most comfortable, your very own home. I'm your host, Marilee Orsini, and I've been involved in healthcare at home since 1981. In each episode, I'll be talking with a guest who will help us in our quest to educate about receiving care at home. So let's get started on today. This is episode number 3, and today's guest is Deborah Hoyt. Deb is president and CEO of the Connecticut Association for Healthcare at Home. Deb Hoyt, thank you so much for joining us today. You have been involved with the Connecticut Association for Healthcare at Home for some time now, and really I think your passion is advocacy for home care.
Right, Marilee, and thank you for having me as a guest. I truly appreciate what you're trying to do in terms of communicating out the value of healthcare provided in the home. So yes, I'm the president and CEO of the Connecticut Association for Healthcare at Home. We're the state advocacy trade association for the medically licensed and certified home health care agencies, such as your visiting nurse association agencies that have been around in the state for about 100 years, as well as some of the other for-profit home care agencies that are taking care of literally tens of thousands of people every day in their homes.
And you have a big picture view, though, I think, from your time in home care. And we've not really had that yet in terms of how is home care playing out currently and in the future. Could you give us some perspective on that?
Sure, Marilee, my pleasure. So home and community-based care has been taking place in the United States for over 100 years in people's homes. So community-based care, whether it was the doctor that used to make home visits with his little black bag seeing people in their homes, back in the 1950s and 60s, to community-based nurses, with the VNAs that used to make house calls and take care of people in their homes. This concept has been around for a long time. However, over time, obviously, larger brick-and-mortar hospitals and nursing homes and other types of skilled medical facilities has kind of blossomed, and we've been centralizing, kind of warehousing people that are ill in institutions. Whether that be people needing medical care or people needing behavioral health or mental health care. But I think that the nation has been taking a look at how we've been caring for individuals, and the cost of institutionalized care, inpatient care, is very costly, whether it's insurance companies that are paying for that or whether it's Medicare or Medicaid paying for that, which is the state or the federal government. And we're finding that we're in a real situation where healthcare is such a large portion of the state and federal budgets that we need to find an alternate solution. So I think going back to the older concepts of, home visits, doctor visits, home and community-based care, keeping people with chronic illnesses managed in their home, whether they need assistance with their medication regimen or whether they need, if they're diabetics and they need insulin on a daily basis and need assistance with that, or people that are just aging in place or aging at home. We find that it's really important for them to have different options rather than being institutionalized for long periods of time. It's for their own, obviously for their own and their families' benefit, because people want to be at home. People are saying that they prefer to receive their care in a home setting where they can be surrounded by their loved ones and their families, as opposed to being in a place where people need to travel to go see them, and obviously that's more costly. So I think the economics of healthcare are driving us to look at new solutions and new settings, and I think home and community-based care is kind of bringing us back to the basics, and there's so many benefits of it, Marilee.
Talk to me a little bit about those benefits from where you sit.
Okay, well, obviously, as we said, home and community-based care, whether it's your own personal home, whether it's a group setting, a group home, or whether it's in, a senior citizen type community or village where people have the support of other people and their peers around them. Care in those types of settings is what people prefer most. There's been national studies where people say, 9 out of 10 times they like to receive care in the home. Obviously, we're all aging. I think the state of Connecticut, where I am, is one of the oldest states in terms of the mean age. In the nation, we see that people are aging, and we're trying to figure out, as people live longer, they're not necessarily living healthier. We're seeing the average individual that are in their 80s, 90s, and we're even approaching 100. These individuals may be on 5 to 8 different types of medications, whether it's for diabetes, congestive heart failure, high blood pressure, or some other type of chronic illness. People have to learn how to live with the different conditions that they have, and they can do that successfully at home. They don't have to be hospitalized or live in a nursing home. So we're trying to find solutions for people that are looking to age in place and try to be, continue to live out their normal routine with their family and with their friends. And isn't that the goal, right? We want people to enjoy their lives at the end, as they get older and get towards the end of life. And they can do that with home-based care. The need for home health is exploding. We need, the on-the-ground army of home health workers, whether they're nurses or physical therapists, occupational therapists, what we call the homemaker and companion type folks that can help people just with bathing, with cooking meals, with just being a companion or someone that can drive them to their medical office visits, take them grocery shopping, and help them with paperwork. There's a full continuum of care that can be given in the home based upon a person's individual needs.
Why do you think that home care has taken so long to come to the forefront, to be something that we as a nation are embracing? Because these benefits you're talking about and also the value of home care obviously are undisputed. So is there some reason why we've not been embracing home care before?
I think that oftentimes the financial incentives are not always aligned with perhaps what's the best in terms of in terms of healthcare in general. So, for instance, over the past 40, 50 years, the reimbursement model, meaning the payments to physicians, to hospitals, to nursing homes, and even to home and community-based providers, has basically centered around a fee-for-service type model. And without getting too technical, basically what that means is that, if services are provided, the institution or the medical provider receives payment for the services rendered. And I think as we're finding that as a nation we're kind of outspending our ability to pay for all of this, and we've built this complex infrastructure, and there's also profits that are built within this so that, the various organizations, whether they're insurance companies, whether they're hospitals, whether they're large health systems, there's a profit margin that's built in there. We are just not able to keep up with it anymore. So many years ago, or several years ago, the Affordable Care Act was introduced, and we've been trying to work on ways that we can make healthcare delivery more affordable and at the same time more practical for the individual or the patient. So the incentives have been realigned so that care delivery is not just an open blank check where, the more care that's delivered, there's more reimbursement back to the provider. There's a lot more scrutiny, and there's checks and balances in terms of eligibility and accountability around the delivery of care. So what we are seeing is a shift to the lowest cost healthcare delivery setting, which is home and community-based services. On average, a home care visit is around $130 a day for a nurse to come out and do a full assessment and to provide the various care, whether it's medication management or some type of chronic care management, versus a nursing home that might be about $450 to $500 a day, and a hospital is, in the thousands, depending on what type of care would be required and what level of care. So I think there's an understanding at the federal level, and Congress is taking a look at the payment methods, and we're seeing a real shift in terms of, addressing individual needs, taking a look at the setting, the healthcare setting that is appropriate for that individual, and moving people and thoughtfully moving people from institutionalized care to home and community-based care. So I think we're seeing people being treated in the home where they used to be in a hospital. So it's really kind of the hospital at home concept that's, moving people to a setting they prefer, but also at the appropriate price.
What role does technology play in this new healthcare at home scenario?
As we've seen, people are all now walking around with handheld cell phones, which are really computers, that can do basically anything. We've been seeing a lot of interesting applications for technology. Individuals can actually use their own cell phone with certain apps, and they can, take their own blood pressure. If they're a diabetic, there's some certain attachments that can go on phones to read their blood sugar at any given time, and then that reading could be instantly emailed or texted to their physicians so that they could have real-time conversations with their physicians. Everybody or individuals having a cell phone is an instant opportunity to communicate with your healthcare provider in real time, which is very exciting. And that's really opened up the door to be able to have more home and community-based care. There's no need for people to be, hooked up to machines in an institution. You have the ability to read people's vitals right there, and it's right there at your fingertips. So technology, whether it's through handheld devices or whether it's through, electronic medical records where all of your healthcare information is now becoming more portable as you need to go from setting to setting, we're finding that technology is driving, the movement to home and community-based care, which is very exciting.
To the general consumer who would have a care need present, and let's just give a scenario: someone's had a fall, and they may have broken their hip or injured it severely. So that person gets in an acute setting. As a consumer, where would the consumer go to find out about choosing home care? Does that happen in the institutional setting now?
Making sure that consumers know what their options are and being educated about different types of settings and what type of care you can receive in those settings is really important, because what we're finding is that, in the example you just gave, just for instance, if that's my aunt, she had a fall, she broke her hip, so obviously she would be going to the hospital to make sure that whatever surgery or whatever type of, acute recovery she needs, that would take place obviously in a hospital, and that's the appropriate setting. From there, she'd probably go to either a skilled nursing facility or a rehab facility to be able to regain the movement back in her hip and get her back to her physical mobility. We're now seeing that people are going from hospital to home. We're seeing that there is all kinds of physical therapy options people can receive in their own home, where physical therapists would come in, and it's a lot less costly. You're in your own home as opposed to paying for a daily rate in a nursing or skilled facility. So the key here, I think, and you mentioned it, is that the individual, the patient, or the family members need to ask the physician what the different options are for the entire plan of care or the plan for the recovery. So I think that if you don't ask, a physician may default to, the traditional care plan, which would be inpatient. But we're seeing now that as hospitals and nursing homes and home health care agencies are aligning under new payment systems, they are now sharing the incentive to be able to bring individuals to the lowest cost setting where they're going to get really good quality results, and oftentimes that's home. So physicians are becoming educated as the consumers are as well.
So home is the lowest cost setting, and I'm assuming that's also the highest value option for the individual.
Exactly. So home care is the highest value. The quality results for home-based care are posted on the internet. We have Home Health Compare There's all types of very transparent data that you can find on home health care agencies. And I know that from Medicare and Medicaid, so Medicare is for senior citizens and those that are 65 and older who require, who are under the federal plan to receive health care. There's a lot of oversight. There's a lot of data that's being collected in terms of looking at cost comparisons between the different healthcare settings and how the Medicare population is aging and what the cost is going to be for them as more and more of us, 10,000 people a day, are becoming Medicare eligible. I actually was looking at, there was actually a Wall Street Journal article on February 25th that just came out, and the title of it is What the Hospitals of the Future Will Look Like. And it had a lot of interesting examples about exactly what we're talking about. Taking the infrastructure, the brick and mortar of hospitals, and looking at how they can reinvent themselves to be more cost effective in the future. And the article really talks about helping patients move to home-based settings, and that studies have shown that hospital-level care at home for certain types of conditions can be provided for 30 to 50% less than inpatient care and actually results in fewer complications, lower mortality rates, and higher patient satisfaction. So elected officials and policymakers are looking at this data now, and they are expecting that providers and consumers both will come together and help us transform how care is delivered in the future.
You've been advocating in the legislature, in the Connecticut legislature, and also nationally for some time. How do you arm your information? How do you arm yourself with information to take to lawmakers, and what are the roadblocks against home care from a legislative or regulatory standpoint?
This is something that I've been doing for 8 years here in Connecticut. So part of the role of the association is to represent the home health providers in the state. And one of the exciting things is that we have very compelling data. And I think when you speak with a legislator or a policymaker, you need to be able to show numbers that are actually proving your point and showing results. So when we go to the state legislature here in Connecticut, most of what we speak to is state Medicaid clients and beneficiaries. So the state of Connecticut, in the state of Connecticut, about 1 out of every 5 individuals in the state, that's about 20% of our state population, receives their health care under some type of a Medicaid program or a waiver program. When we go to the state legislature, which we're doing now, we're in the middle of our legislative session, our appropriations committee always likes to hear about how much home health care is saving the state general fund or the state budget when it comes to Medicaid expenditures. And we've have some really compelling data. And we say on average about $103 million each year is being saved by having the Medicaid beneficiaries go to home and community-based care type programs, as opposed to putting them in nursing homes or having them in institutionalized care, when they really can get a good quality of life being at home and having the appropriate level of caregiver come into their home every day or a couple of times a week. So we just received some new data, Marilee, that more than $342 million last year in Connecticut was saved by having people come home from nursing homes. So there's been a conscious move, and they call it rebalancing here in Connecticut, moving people from institutionalized care to home and community-based care. And the state of Connecticut has even invested in housing. They've invested in adapting people's living quarters. They've actually transitioned individuals who've lived in nursing homes for 20 years and moved them to either group homes or some type of apartment type setting that will be very comfortable for them. And it's actually less expensive for the state to pay for the revisions made to a home setting to make it maybe handicapped accessible or make it a comfortable environment and have the individual receive home and community-based care. So in the long run, that's definitely the value proposition. And lawmakers are listening. The challenge is we have to make sure that the home care agencies and the home care workers are receiving appropriate reimbursement under Medicaid and under other health plans so that they can continue doing the good work that they're doing. And that's the biggest challenge right now.
Is there a role for the consumer in meeting that challenge?
You know, it's interesting, Marilee, because we often see the disability community and other type of community advocacy groups come to the legislature when we're in public hearing settings, when we're testifying, and they testify as well, saying, we want to keep our home care worker, we love our nurse, Mary, who comes in every day to take care of my mom. Her diabetes situation's been improving, her health has been improving, but we're hearing that, the state is going to cut this program or the state is reducing reimbursement to the home care agency, so the nurse is no longer able to come out to see my mom. So we're hearing these stories from consumers that are supporting home and community-based care. They love it. When we speak with them and when we meet with them, they say, how can we help you as providers continue to do what you're doing? And we're seeing the challenge that more and more individuals need home-based care, but one of the biggest challenges beyond reimbursement is the workforce. We're finding that finding good and employing good home care nurses and therapists and homemaker companions are really challenging in Connecticut, and we're hearing that nationwide it's the same type of situation.
But regardless of the kind of care, whether you were receiving it at home or receiving it in an institutional setting, wouldn't the workforce shortage cover all of those settings, or is it just particular to home care?
Marilee, we're actually participating in a nationwide study now. We're hearing from some of the other settings that it's challenging to get nurses and other types of skilled individuals at all different levels, whether it's in a hospital, in a nursing home, or in home care. But home care is a little bit unique. The workers that, whether it's a skilled RN, a skilled nurse that's going to be going and doing home care visits, maybe they do 6 visits a day, and they're driving in their own car, and they're going to scheduled visits every day, and every week they have other visits they have to make. But they're pretty much on their own. The personality and the skill level of the individual doing home health nursing is a lot different than maybe a young nurse that's just coming out of nursing school and wants to work in a hospital setting where they're on the hospital floor, they have full support of a supervisor and an entire team. Usually the physicians are right there with them. When you're a home health nurse, you are pretty much independent and on your own, although obviously you're connected 24/7 by your handheld device and your computer. You have all of the information you need in terms of your patient record and their care plan there. You do have to call the physician with questions and to get updated medication, prescriptions. You have to have good judgment, and those individuals are, very rare and hard to come by. And we're seeing an aging of the really good home health nurses themselves, and they're getting closer to retirement age. It's a hard job, and I think that, we really have to be conscious of thinking about how we're going to, groom the next generation of home health workers and pay them appropriately.
And if you had any messages for young people who are currently thinking about career choices, would you steer them into home care?
We have actually a nurses meeting, or it's actually young nurses meeting. It's a career meeting here in Connecticut once a year. The Connecticut League for Nursing hosts that. There are usually about 900 people that attend that, and they're all either student-level nurses or individuals that are interested in going into nursing, and we're always trying to communicate to them the value of independence that you receive in home-based nursing, the opportunities that are there for you. It's a totally different environment. You make a real difference in people's lives. You actually go into their homes and you meet their families, and the type of relationship is so much closer if you're in a home-based setting than if it's an institutional setting where you may only see people, for a couple of days, and then, they move on to the next setting. So we do encourage them to move into home care, It's just, the fresh young nurses out of nursing school may not feel as though it's right for them right away. They might need a couple of years, in an institutionalized setting to get more skills under their belt. But the pay scale also is a challenge because the larger institutions and hospital systems can pay a little bit more to their nurses than maybe a smaller home care agency can. So it's very challenging. We definitely need to look at this and make sure that this is a top priority as we move forward because, if we don't have enough workers to be able to take care of the growing number of people that are aging in place, this is going to be a real challenge, not just, in our state, but nationwide.
Well, Deb, you have certainly given us lots to think about today and lots of very, very helpful information. So I want to thank you for your time and for your expertise and also for helping us educate the consumers about how to choose home care as an option. So thank you very much, and you have a great rest of your day.
Thank you, Marilee. It was my pleasure.
Thank you so much for listening today, and a special thanks to our sponsors and partners, Access Technology, National Association for Home Care and Hospice, and Core Cubed. And won't you join us to spread the word and help choose home when care is needed?